Good morning, good afternoon, good evening, and good night, wherever you're joining us today in today's live lecture coming to you from Nkolo Mahadum Wisdom University. Today's date is Nkwo Market Day in the Igbo lunar calendar and 9/9/25 in the Roman Catholic calendar. The reason we are giving you both calendars is for you to know that we, the Igbos, we, the Africans and Biafrans, have our own calendar before the arrival of the colonial masters. And our calendar supposed to be the one we should be using. And remember that at Nkolo Mahadum, we always advise you to use your naturally given common sense, which we call Akonuche in Igbo language. And Nkolo Mahadum Wisdom University was set up to reposition the Igbo race, the Biafrans and Africans, from the miseducation, misinformation, and misdirection from our colonial masters and their institutions and stooges in our land. That's why we are calling on you all the time to please join us, subscribe, and follow us on YouTube, Facebook, Twitter, and TikTok. And right now, we are live on YouTube, we are live on Facebook, we are live on TikTok and Twitter. So you don't have any reason not to participate in today's live lecture. The title of today's lecture is The Best Healthcare Approaches for the Igbo Race, Biafrans, and Africans. The best healthcare approaches for the Igbo race, Biafrans, and Africans. And this can be achieved by educating our leaders to change their direction, to know that investing in human beings, investing in saving the lives of our people should be the first priority. And a good health care, as defined by Nkolo Mahadum Wisdom University, is a health care approach that takes care of everyone in the population, in the geographical area where you are living, including the mother before conception, during conception, that is during pregnancy, and then birth, and care of the mother after birth of the child, and the care of the mother and child after birth in a controlled environment. This is the definition of a good healthcare system by Nkolo Mahadum. Again, a good healthcare system, as defined by Nkolo Mahadum Wisdom University, is the healthcare approach that takes care of everybody in the community, including a woman who will now, take in, that is, who will not take in, carry the pregnancy, and deliver the baby. And what kind of care is provided to this mother and the child after delivery in a controlled environment. So what we are saying here is, before this woman gets pregnant, how does the mother fed? How was the mother being fed? Was she eating nutritious food? And was she having medical attention? Was she getting medical attention? During the pregnancy and birth, was the mother provided nutritional diet and medical attention? Like how many ultrasounds, how many doctors' visits did the mother had before delivering this child? And when she delivered this child, how much attention did she get afterwards? Is it 1 year? Is it 2 years? Is it 3 years? And how was this child also be taken care of after birth? Of course, it should be throughout that child's life until that the child, leaves this world. So that is what we are saying. And in a controlled environment, what we mean is that there should be a 24-hour electricity in all the houses, in all the hospitals, in all the clinics, in everywhere in our land. There should be 24-hour electricity. Because if there's no electricity, which means the rooms, we cannot stay in a controlled environment. You cannot put on the fan, you cannot put on the AC, which means you will be staying in a hot environment. You'll be staying in an environment where mosquitoes will be biting you. You will stay in an environment where you cannot close your doors and windows. Because when you have air condition, you can close all your doors and windows and still be comfortable in the room where you are. So the first approach is to make sure that our environments are controllable. Our environments are adjustable. The temperature is controllable. Controlling the temperature of where we are staying is part of good health care. And before this can be achieved, the State Houses of Assembly or the Southeast Development Commission or the South-South Development Commission or the Eastern Region Development Commission, or if you have like African Union, AU, should have a policy that will ensure that, number one, there is agricultural self-sufficiency in Africa, or in Igbo land, or in Biafra land. Because population must be feeding well. Feeding well is part of good health care. Because we all know that many of our people die and suffer out of hunger. Hunger is a disease. So the first approach is for the state assemblies of the Southeast, South-South Development Commissions, or policy by African organization, African Union, that there should be agricultural self-sufficiency in Africa, in Igbo land, or in Biafra land. With that agricultural self-sufficiency, our people can be feeding well. So when you know you can eat, when you know you don't have to worry about food, that is health in itself. And then those organs of government, that is the state assemblies, the Southeast and South-South Development Commissions, or African Union policy, we mandate that every household, every clinic, every hospital must have 24-hour electricity. So when you have 24-hour electricity, that gives you room to have like fan, to have like AC in the homes and in the hospitals. You can also be able to use the electricity to, for the equipments, for the various equipments that is needed in the hospitals. So these are some of the things that we have to do to have a good health care in our land. Also, the State House of Assembly, or the Southeast Development Commission, or South-South Development Commission, or the Eastern Region Development Commission will pass a policy or a law saying that no mosquitoes are allowed in the houses, in the clinics, and in the hospitals. There should be no mosquitoes allowed, because you cannot stay in a hospital or even in your house and mosquito will be biting you, because mosquito is the one that causes malaria. and other diseases. You cannot stay in the hospital or in the clinic where you are getting treatment and mosquito is biting you. That is not treatment. That is not how to get good health care. First of all, you have to secure the environment. Make sure that it is controllable. Make sure there's AC. You can adjust the temperature as you want to align with your body. And also that you are not bitten by any insects, including mosquitoes. So that's what should be done. And then the state assemblies and the Southeast Development Commission or South-South Development Commission or Eastern Region Development Commission should also pass a law on the training of the professionals that will be taking care of our people, be it medical doctors, be it pharmacists, be it nurses, be it respiratory therapists, be it occupational therapists, physical therapists, and all other professionals that are needed to manage our people. The state should pass a law stating the standard of education, the standard of training that every profession must have in order to be qualified to manage and treat every disease condition that our people are having. Also, ambulances should be everywhere. Every village should have an ambulance. Every town should have an ambulance, depending on their population. Every clinic, hospitals must have ambulances to bring patients, to bring people to the hospital and take them back home, to rescue people who have heart failure or heart attack or accidents. Ambulances must be everywhere in our land to be doing their job effectively. Again, there should be free transportation. There should be free transportation and free medical care and pharmaceutical care. So there should be, everything should be free. Transportation, medical treatment, pharmaceutical treatment, everything must be free for our people. Yes, they must be free. And we are saying that investing in the lives, in the protection of lives of our population should be the first by everybody. And it is only the government, only the government that have the resources and power to implement these policies effectively. It is the government. They can partner with some private, what they call government-private partnership. But it is government that control all our resources, that have the resources to implement this type of policy in Igbo land, or in Biafra land, or in Africa. Because they are the one with all our resources. They are the one. So whatever we are doing individually will just be to add to what the government is doing. But the government must make sure that taking care, investing in the treatment of disease conditions, providing adequate health care for our population should be the first. Because what else do we get in this world than the longer we live, the better for the human being? And that's what the government should be aspiring to achieve. And hence, this lecture today, to advise everybody, because people that are not in government today can be in government tomorrow. They are the one to make sure that this type of policy is implemented across the Igbo land, Biafra land, and Africa. So what we are saying here is that the best healthcare approaches for the Igbo race and Biafrans can be achieved by educating our leaders to change their direction. And that's what we are doing here at Nkolomo Wisdom University today. This type of education is what we need constantly for our leaders, for everybody in Africa, so that we can change our way we can change the direction where we are going. We don't have to be following others, following the Western approach, because most of these Western countries, European countries, they're already doing those things. They already have those things for their population. So how then are we going to be following them without, first of all, implementing these basic necessities for our people? And we at Nkolom Hadum have defined a good health care as the health approach that takes care of everybody in the community. Because it is the woman that eventually gets pregnant is part of the community. So when you have free health care already in the community, everybody benefits. Both the young, both the one born today, both the young, both the youth, both the elderly. Everybody should benefit from it. And so when a woman now gets pregnant, she's also a beneficiary of that, of the free education in their population. And now when that woman gets pregnant, then she should be given special treatment, making sure that the child is monitored, making sure that the pregnancy is monitored. And when the child gives birth, the mother should be taken care of, giving free food, paid salaries, giving free medical care, and the child also the same, making sure the child is well brought up healthily. That is where the health starts. That is where good health care starts, from birth. And it is the government responsibility to implement different programs to make sure that everybody born is healthy and well and alive. And we are asking, before this woman gets pregnant, how is she feeding? What kind of food was she eating? Was she eating nutritious food? Was she, before she gets pregnant? And then now when she gets pregnant, what kind of food are you giving her? What kind of medical care is she getting? Is she going to ultrasound? How many times did she see the doctor before delivering that baby? And after she delivered that baby, for how much longer? Is it 1 year, 2 years, 3 years? Did the government continue to take care of this woman and making sure that she's okay, feeding her, giving her medical care, as well as that child? And the child will continue because there's a free health care in the environment already, which is benefiting everybody, and enough food, like we mentioned earlier. And so what we are saying also in the definition is that a good health care, as defined by Nkolom Hadum Wisdom University, is the healthcare approach that takes care of everybody in the community, including the woman before she gets pregnant, during pregnancy, and the care of the mother and child after birth in a controlled environment. And in this controlled environment, we are saying that you have to have 24-hour electricity in our homes, in our clinics, in our hospitals, in order to help us to be able to have a controlled environment. And remember, the clinics and the hospitals are two ways. There are two types. The first type is our own ancestral way of taking care of our people. The orthopedics. The are the orthopedics. That ones were there before the white man came. And ndudibe mbologu na mkpa akwụkwọ, our medical doctors before that give the medication. Dibia ndu na-akpa mbologu na mkpa akwụkwọ are there before the arrival of the foreign colonial system of Western medical and pharmaceutical care. So there are two. So we are saying that for this type of health care being defined at Nkolomahadu Wisdom University to be effective, the state assemblies, the Southeast and South-South Development Commissions, or the Eastern Region Commission, or African Union, AU policy, should make a law that there should be agricultural food self-sufficiency in our land. Because if we have agricultural self-sufficiency, we can be feeding well without, looking for food. Everybody will be eating. And eating well is part of good health care. It decreases sickness. It decreases death. It makes somebody happy. And we're also saying that they should pass a law that every household, every clinic, every hospital should have 24-hour electricity. They should. If they cannot afford it, the government should subsidize it. That is how it is done everywhere. For households or clinics or hospitals that cannot afford it, then the government will come in. It should be a government project. And if we say that the foreign technology, like the AC and fan we are using now from foreign countries, that we don't want that one. We can educate, train our youth to produce our own type of AC and fan system and cooling systems. Yes, we can do so. Why not? If we don't want these foreign ones, yes, the government can invest in our youth to produce our own African AC, our own cooling center, our own fan. These are the things that we need. And so we are saying that also the same state houses of assembly, Southeast Development Commission, South-South Development Commission, or Eastern Region Development Commission, or African AU policy will also make a law that no mosquito will be allowed in the houses, clinics, in fact, in all our environments. There shouldn't be any mosquito. Because the government can have a program of spraying insecticide. People do it in other countries. The government sprays insecticides that will kill the mosquitoes. Make sure that all the gutters, there's no standing water in the gutters, that all the gutters are flowing freely. All this will decrease, mosquito bites and malaria and disease that we are having in our land. And we are saying that ambulances should be everywhere. Ambulances should not be a problem. In many occasions, you see fire burning in filling stations, burning in shops. You see people shouting. There's no ambulance. Ambulance should be everywhere, in the villages, in the towns, in the hospitals, in the local governments. Make sure that ambulances are there. Both fire trucking companies, all of them should be there to make sure that no life will be lost from fire or any accident or other accidents that do happen from time to time in all places. They should be there. And our people should be trained to even produce our own ambulances, to produce our own fire trucks. We don't have to be dependent all the time from the foreign ones. We can produce our own. So these are the things the government should be doing to help us to have adequate, the best health care for our people in Igbo land, in Biafra land, and in Africa. And we're also saying that there should be free transportation. If you are going to the hospital, they should send ambulance to you for free transportation to the hospital. Free medical care after everything all the treatments you are getting from the hospital should be for free. All the pharmaceutical care should be for free. Nothing should be paid for by anybody, by the people, by the population. Should not be paying anything for healthcare. They are all supposed to be done by the government because they are the one controlling all the resources that is coming from our land. And we are saying that the government should know that investing in the protection of lives of our people should be their first priority. It should be their first priority because they are the one that is in charge of everything. They have the resources. All they have to do is to make some changes. Make some changes. Decrease the number of commissioners or ministers. Decrease the number of people in the secretariat. Sometimes you go to the secretariat, you see some people sleeping there. They're not working. Make sure that anyone that is working in the government is producing, is efficient, is doing something, and not coming to the office, sign a paper, and walk away. Some will be in their offices selling other things, doing some minor business in the office, while they are being paid by the government. So the government just have to make some changes in what they're doing, and they will have the money to make sure that there is adequate health care, free health care for our people. That's what we are saying. And we are, before we continue, I want to beg you again to please join us, subscribe, follow us on YouTube, Facebook, Twitter, and TikTok. And go back to our previous lectures, and you'll be glad that you did. So in conclusion, what we are saying is that the best health care approach for the Igbo race and Biafrans and Africans can be achieved if our leaders, if everybody will agree that investing and protecting the lives of our people should be the first thing for everybody. When we agree on that, whoever gets into government will be able to make sure that they are implementing the things that we are saying in this lecture. Making a policy to make sure that there's agricultural food sufficiency, that there's food in the land, there's 24-hour electricity, that there is standard training for all the professionals working in the medical area, be it doctors, pharmacists, nurses, respiratory therapists, physical therapists, occupational therapists, and the rest, and caregivers. Making sure that our houses, clinics, hospitals are being controlled. And you cannot control the environment, the temperature, without 24-hour electricity. So you have to have 24-hour electricity. And our youth can even produce our own cooling systems, our own fans, our own air conditions, our own ambulances, our own firefighters. All this is left for the government to change a policy and have it done. And we are saying also that the government can help to make sure there's no mosquito in our land. When we have controllable environment, we can be able to be locking our doors, locking our windows, and adjust the temperature to suit our body temperature. And we'll be okay in the house. Mosquito will not come in. And the government can also be spraying insecticide across the whole land to kill insects and mosquitoes and decrease disease and the death for our people. And we're also saying that adequate equipments should be provided in different areas. Provide equipment for colonoscopy. If you cannot provide it, have our people build it. Our youth can build it. Have our people provide equipment for cancer treatment. Have our people provide or build equipment for prostate cancer or prostate disease, and so many others, heart disease, and so many, kidney disease, and so many others. Make sure we have the equipments to treat our people. If we don't like the foreign ones, have our youth produce what we need. This is how we can have the best health care for the Igbo race, for the Biafrans, and for Africans. And we also said that ambulances should not be something that is expensive. We can build our own ambulances, and it should be everywhere. Firefighters should be everywhere. It shouldn't be a very high commodity like that. Produce our own version, the Igbo man version, the Biafran version, the African version. That is what we need. And we are saying that all this transportation, medical treatment and care, pharmaceutical treatment and care, everything should be for free. Occupational therapy, physical therapy, respiratory therapy, all kinds of care should be free, written off by the government, subsidized by the government. And what we are saying is that it is the best thing for everybody, for the government to be investing in the lives of our people. Now, that is the first thing. And only the government can do that because they are the one controlling all our resources. And with this, we shall be bringing today's lecture to an end. But before we do, we want to let you know that it is only we that can solve our problems. No foreigner, no other person can come and solve your problem. It is we Africans, it is we Igbos, it is we Biafrans that can solve our problems. And we can. With good leaders, yes, we can. And with this, we shall be bringing today's lecture to an end. Thank you very much for joining me, and have a good day. And share this lecture, like, comment, and share. Thank you so much, and have a good one.